Hello everyone, good evening to all my dear viewers and my dear students. I welcome you all in my surgery online class, and today topic of discussion is sickle cell anemia or sickle cell disease. It is a hereditary hemolytic disorder which results in anemia. Now what is anemia? Anemia means deficiency of hemoglobin in the blood, which can be caused either by too few red cells or too little hemoglobin in the cells. Anemia is categorized into many types. Hemorrhagic anemia, when anemia occurs due to hemorrhage. Hemolytic anemia is a condition where hemolysis occurs, means destruction of RBCs. This is also known as sickle cell anemia. Aplastic anemia is due to the disorder of red bone marrow, and nutritional deficiency anemia occurs due to deficient intake of nutritive substances like iron, protein, vitamins like C, B12 and folic acid that are necessary for erythropoiesis. Sickle cell anemia or sickle cell disease is a hereditary hemolytic disorder in which hemoglobin A is replaced by hemoglobin S. This results in crescent-shaped erythrocytes. It is a group of inherited red blood cell disorder. Healthy red blood cells are round and they move through small blood vessels carrying oxygen to all parts of the body. In sickle cell disease, the red blood cells become hard and sticky and looks like C-shaped farm tool called a sickle. Sickle cells die early, which causes a constant shortage of red blood cells. Sickle cells can get stuck in small blood vessels and block the flow of blood and oxygen to organs in the body. These blockages cause repeated episodes of severe pain, organ damage, serious infections, and even stroke. In sickle cell anemia, hemoglobin A is replaced by hemoglobin S, and this results in crescent-shaped erythrocytes. This HbS molecule crystallizes if there is hypoxia, strenuous work, or due to dehydration. As a result, these red cells are distorted and elongated. Therefore, blood viscosity is increased, causing obstruction in splenic circulation. Disease is very common in Africans. Most of the patients in India have high HbF levels which protect HbS. Hence, symptoms are not seen in first few weeks. Sickle cell anemia is a hereditary hemolytic disorder when both the parents are carrier. Means if both the parents are having sickle cell trait, then the inheritance of the two copies of HbS will cause sickle cell anemia in the offspring. There are four main types of sickle cell anemia which are caused by different mutations in these genes. The hemoglobin SS disease is the most common type of sickle cell disease. It occurs when the person inherits copies of the hemoglobin S gene from both the parents. Let's understand the clinical features in case of sickle cell anemia. There is severe abdominal pain due to recurrent infarcts or due to gallstones in a few patients. Skin ulcers occur due to anemia or hypoxia. Leg ulcers due to dying tissue of leg. General features of anemia like pallor, weakness, fatigue, lethargy. Recurrent infections, neurological symptoms, neck stiffness, headache, dizziness, syncope, jaundice due to hemolysis, and visual blurring. Patient may complain of excessive fatigue or irritability from anemia, bedwetting from associated kidney problems. Jaundice occurs due to hemolysis that can be presented as yellow color of the eyes and skin. There could be frequent infections. There is swelling and pain in hands and feet, pain in the chest, back, arms or legs. Central nervous system features are hemorrhage and paralysis, and if the effect goes on heart, that causes chronic heart failure. Urology features are hematuria and diuresis. In musculoskeleton, there is painful swelling of hands and feet. In ophthalmology, there could be blindness and retinopathy. In dermatology, there is ulcers. In lungs, it causes pneumonia, atelectasis, and pulmonary hypertension. Respiratory rate also get increased. In GIT, it can cause hepatomegaly and splenomegaly. Besides this, microinfarction of carpal and tarsal bones resulting in bony pains, which is described as hand-foot syndrome. In complications, this may cause further hyposplenism, cholelithiasis, that is the formation of gallstones, and cholecystitis, osteomyelitis, infection of bones, increased risk of severe bacterial infections, infarct of cerebrum resulting in hemiplegia, and pulmonary infarction resulting in chest pain. In diagnosis, patient is recommended for peripheral smear, sickling test, HB electrophoresis, and PCR. Here I have shared the picture of microscopic field taken of sickle cell anemia. There is no single best treatment for all people with sickle cell disease. Treatment options are different for each person depending on the symptoms. Treatment can include receiving blood transfusions, maintaining a high fluid intake, and patient is recommended to drink 8 to 10 glasses of water each day. Intravenous fluid is given into the vein and medications to help with pain, because the HBS molecule crystallizes if there is hypoxia, strenuous work, or in case of dehydration. The four main treatment options are blood transfusions, drug treatment which includes folic acid and penicillin, blood and marrow stem cell transplantation, and gene therapy.